Cześć, witam was wszystkich bardzo serdecznie w takim trochę nietypowym odcineczku z mojej na moim kanale. Słuchajcie, a więc dzisiaj jesteśmy sobie w takiej grze, którą ja grałem jako dziecko, takie 6-letnie. Nie wiem, ile mogę mieć lat, 6-7 lat. Jest to Operacja Biodra. Także jeśli jesteście ciekawi, jak wygląda Operacja Biodra, w jaką grę grałem jako dziecko, to zapraszam was do oglądania. Okej, a więc jest ta gra, jest to internetowa gra, także nagrywam sobie, przechwytuję sobie ekranik. A więc możemy sobie tutaj zobaczyć zdjęcia prawdziwej operacji, z prawdziwej operacji, ale tego nie będziemy oglądać. A więc tak, jesteśmy w recepcji i zaczynamy sobie operację. Please turn on speakers or plug in headphones. You may turn off audio using button in the bottom right corner. No dobrze.
Hello. You're about to embark on a surgical mission called Total Hip Resurfacing. I'm Dr. Mark, and you will assist me in the operating room. You think you can handle it?
No, chyba sobie poradzimy.
Today, our patient is a 55-year-old man with healthy bones and no significant bone loss due to arthritis.
Ma 55 lat, pacjent nasz, w ogóle w końcu, jara mnie to, bo w końcu rozumiem, o co chodzi w tej grze. W sensie, rozumiem, co tu jest napisane, bo wcześniej jak grałem, to nie rozumiałem, o co chodzi, no bo nie umiałem angielskiego. A więc tak, 55 lat i będziemy wymieniać bioderko.
Because of his young age and normal anatomy, hip resurfacing surgery will preserve more bone than a total hip replacement. Why do you think it's important to preserve bone in younger patients?
Więcej kości niż normalnie. O Jezus, pytanie. Why do you think it's important to preserve bone in younger patients? They might need it for a bone graft. If they break a hip later in life, they will use up more bone if they stay active into old age. It might be necessary to have another hip surgery later and more bone left, the better the outcome may be. Nie wiem, jak się to czyta. Osteoporosis might set in sooner if more bone is taken out during surgery. Dlaczego lepiej to? Myślę, że to.
I would not want to be your patient.
Aha.
That's correct.
Czy jednak chcę.
As you can see, most of the cartilage or cushion
Czyli
between the bone is gone.
musimy starać się zostawić jak najmniej kości, w sensie wyciąć jak najmniej kości, bo kiedyś w przyszłości może być potrzebna kolejna operacja i wtedy będzie lepiej, jeśli będzie, wiecie, więcej kości.
Or cup of the hip. What size do you think fits best?
O Jezus, nie wiem. Który rozmiar? Czekajcie, bo tu jest ta kość, tu jest nierówno, to.
Great! We now know the size of the acetabulum will be 60 millimeters. The femoral head will most likely be 6 millimeters smaller. What size femoral head should we use?
Sorry, that's wrong.
Czekaj, co? D60, to 54.
Yes. With our templating done and our patient prepped and draped, it's time to operate. Scrub in, stat!
Operacja będzie.
Use the sterile marker to draw the location for our incision.
Dobrze. Czyli rysujemy. Się jaram. Kiedyś tak
Now for the incision, grab the scalpel and cut.
Scalpel
nice slice.
Ładnie.
Next, cauterize the blood vessels with your... Now, we'll soak up the remaining blood. These retractors will hold the skin and fat layers back. Take the scalpel and cut through the tensor fascia lata and split. Next, cauterize the blood vessels with your bovie.
Tak. Klikamy
Now
sobie
let's pull back the split muscle using the deep retractors. Watch out for the sciatic nerve, which can be felt through the fat. If we damage it, our patient will lose feeling and have difficulty using his leg.
Oh my goodness.
I'll use two retractors to separate the gluteus medius and expose the piriformis tendon. Then I'll cut the short external rotator muscles and suture them out of the way. See the flexible capsule around the joint? Let's cut open this capsule and I'll need you to dislocate the femoral head. Do this by flexing. Great job! Now we can see the entire femoral head and how arthritic the joint is.
Ciekawe, czy tak
Using a
naprawdę
sizing
wygląda.
gauge, measure the head and neck of the bone. The head size will influence which prosthesis size to use. Seeing we have already templated prior to surgery,
Czemu
why
mierzyć
measure the neck
to?
of the femur again?
Nie przesuwam się. To check whenever using correct type of bone. Tak.
Ooh, I would not want to be your
To
patient.
check, nie, to neck the diameter representing when you know that could be used. This also allows us to double check our measurements.
Nice
Tak, no żeby
job.
sprawdzić,
I've estimated the center of the femoral neck
żeby
and
sprawdzić,
marked the bone
czy
using a
dobrze,
Bowlby cautery device.
czy dobry rozmiar wybraliśmy.
Now place the guide wire, and I'll confirm that the position is
Stawki.
accurate in 3 ways.
Click the center of the femoral head to drill.
First, the alignment guide shows that we have found the center of the neck, and not just the center of the head. Second, if we centered the guide wire properly, this feeler gauge should rotate freely around the neck of the femur, which it does. Third, I'll finish placing the guide wire, and check to see where it exits the bone. Why are so many steps taken to ensure that the center of the femoral neck is located?
I think result. Czekaj, why are so many steps taken to ensure that the center of the femoral neck is located? Being off center will damage the drills and blah blah. I think could result in a patient being.
Sorry,
Good
that's
job.
wrong.
Grab your drill and pass it over the guide wire to prepare the femoral head for the guide rod.
Ale co?
Make sure you don't go deeper than the red line. That line corresponds to the size of our prosthesis. That's some good drilling. Place the guide rod over the guide wire until the collar is flush with the surface of the femoral head. Good job! To fit the prosthesis, we need to shape the outside of the femoral head with the cylindrical reamer one size larger than our prosthesis.
Ja mógł być takim lekarzem, bym tym tak żygał,
Your
wam
mom would
powiem.
be so proud right now. I will finish with a smaller reamer. Great! We have changed the diameter of the femoral head to the correct size.
No,
The
no.
next step is to shape the top of the femoral head with the hemispherical reamer. This reamer will allow for a tight fit.
Ale z nas
You're a
chirurdzy,
natural.
moi drodzy,
Before we
czy
fit
ze
the
mnie.
trial component, take the rongeur and cut off the small amount of bone left.
Dobrze,
Now place the
odcięliśmy
trial
sobie.
component on the
Więc
prepared.
teraz sobie
Yeah,
wkładamy
fits
tą,
like a glove. Good work. The head diameter is larger than the component used in traditional total hip replacement. Why will a larger head diameter give our patient an advantage?
Allows greater range of motion and less grip of
That's correct. In order to make room for work on the acetabulum, we will move the femoral head into the pocket created in front of the acetabulum. This allows us to see the acetabulum clearly for the next step. During pre-op planning, we chose a 16mm prosthesis cup for the acetabulum. We will need to gradually increase our reamer size to prepare the cup for the right component. Generally, a cup 1 to 2 millimeters larger than the final reamer size is inserted for a good fit.
Teraz musimy tu coś wcisnąć, tam ja się nie znam na tych medycznych, tych też dlatego
You've done
tego nie
this
tłumaczę,
before,
bo
haven't you? I will finish
nie
preparing
umiem
the acetabulum
angielskiego
for
w
the
stopniu
prosthesis cup
medycznym.
with the size
O co chodzi?
58mm
na tych
reamer.
wszystkich medycznych tam rzeczach.
Now we mount the cup on an insertion device, which also serves as a guide to help find the correct
Wiem
orientation.
angielski na tyle, żeby
Align
sobie
the
poradzić
device with the
samemu
lines
i
shown.
dogadać się ze wszystkimi.
Tap
w
the
ogóle.
cup into the acetabulum until the bone completely surrounds.
Ale
Before
żeby
we
tak,
test the
ten
prosthesis, we need to remove
medycznie
any bone
angielski, no to
spurs
już jest
using the
zbytne.
rongeur.
Use coś tam to remove the bone, coś tam, no dobrze.
Time to test the prosthesis for stability. If the hip is able to move freely, then we know the prosthesis is not likely to dislocate. I will pick up the leg and make sure it straightens all the way. Then rotate the foot and knee out. Then rotate the leg in. Finally, push the... This test shows good range of motion and hip stability. It looks great. Okay, let's put the real prosthesis in. First, we'll dislocate the femoral head and remove the trial prosthesis. Now we're ready to cement in the permanent femoral prosthesis.
No to teraz
Use the burr to
zakładamy
create a
tą
small trough in the femoral head where
właściwą,
indicated. Why do we need to make a small trough? Try again. Grab some cement and spread it onto the femoral. Then use the impaction device to gently tap the prosthesis in place. Now we'll wait for the cement to harden.
Jak to się nazywa? Nie wiem.
I will put the hip back into place and check range of motion one more time.
No może ruszyć.
Nice job. Time to close. This part is a little complex, but you've proven how skillful you are. So drill 3 small holes in the femur.
Gdzie? Aha. A, to samo za mną zrobi.
Okay, let's suture hip capsules to the holes you just drilled.
Dobrze. Szyjemy, no.
I'll suture the deep tissue, and you take the subcutaneous fat layer.
Dobrze. Ale fajnie się szyje.
Now use staples to close the surface of the incision. Your technique? Flawless. The OR team will bandage the incision and move the patient to the recovery room. Our patient will remain in the hospital another 2 to 3 days, followed by 3 to 6 weeks of recovery and physical therapy. The downtime will allow his muscles to heal and strengthen. Following that, our patient will have significantly less pain and a higher quality of life. One thing about this surgery that makes it great for younger patients is that it preserves bone, as you can see from this post-op x-ray. Thanks for helping out today, and good luck with the rest of your residency training.
Czyli skończyliśmy naszą operację, a więc to by było wszystko w tym dzisiejszym odcinku, takie randomowe. Wiem, że to są jakieś operacje na gry.pl, więc może też te operacje sobie tam kiedyś zagramy. Więc to by było na wszystko w tym dzisiejszym odcinku, także trzymajcie się i cześć. I dzięki, że pomogliście mi przy mojej operacji. Tak, do widzenia, moi drodzy.